name is Marika. I'm a physiotherapist at sportsinjuryphysio.com. We're an online physiotherapy practice where you can consult a physiotherapist via video call. Today I'm going to show you how to tape your knee for any pain that you get over the front of the knee. Conditions like patello-femoral syndrome, if you've got an arthritic knee that's really painful, or just a really swollen knee that's painful. This taping technique can really help. So what you need is some kinesiology tape. It doesn't really matter what brand it is, as long as it sticks well. Now we're going to measure the distance from below the kneecap all around to surround it to the top. So I've measured 3 of them out so long, but I'm just going to add a 4th one. And honestly, this is not an exact science. I usually round the edges because that stops it from catching onto your clothes and coming off too quickly. So before you apply tape to an area, make sure that it's clean. And by clean I mean that there's no oil on it, or creams, or anything that can make the tape come off. It's also important, if you're allergic to any plasters or anything like that, don't use tape on your knees or any other place of the body, because you may be allergic then. So what you do is you tear the bottom bit to free that up, and for the anchor you never apply any pressure on it, you just lay it down. And we're going to start diagonally underneath the kneecap. That's the tip of the kneecap. Now you pull this bit free and you give it about 50% stretch when you bring it around, and you just lay it down. And then the last bit is without stretch again, otherwise it will just peel off when the person starts moving. You'll also notice that my knee's in about 90 degrees flexion. If I had it straight and applied it, first of all it wouldn't stick well, but second of all, when the person then goes to bend their knee, it'll just come off. Okay, so now we're going to repeat it for the other side. So you tear the bottom bit, that's just going to be your anchor. Now, bottom of the kneecap, we're just going to start to the side of it, and we surround it, giving it a little bit of stretch, but not too much. Last little bit, no stretch on it. And then we do the same with the last 2 pieces. Now if you're quite a small or tiny person, your leg may not have enough space for 2 pieces of tape. Doesn't matter. I'm just using 2 on myself because my legs are quite broad, and it will surround it better. There's no magic in this tape. The tape provides its pain relief from the sensation it gives on your skin. The second thing is that it just provides a little bit of support when you stand up. You'll feel that it feels quite secure. And then the last thing is that it lifts the skin micromillimeters and just helps with the lymph drainage. So if you've got quite a swollen knee, it can be quite good for the swelling in it. Okay, and the last one. And you'll notice that I'm overlapping the previous tape by roughly half. There we go. So make sure that it sticks. Give it a good old rub. Now we've got 1 piece left, and for this one you've got to measure the distance from side to side. And we'll just round the edges again. Now for this, you tear it right through the middle, fold them back on themselves. Don't touch the tape, because otherwise it won't stick that well. Now you really pull it, and we're going, that's the bottom of, or the lower point of the kneecap. We're going just below that. You give this bit quite a bit of stretch, pull it up, stick it down, and then the last bits has no stretch on it. Otherwise they will just come off. There we go. Okay, and then the finished product, once you stand up, will look like that, which is not very pretty, but it really does the trick. If you want to see more information about taping techniques and other information regarding injuries, check out our blog at sportsinjuryphysio.com. Thank you.